Hello, and welcome to the Vlogging Pod. The Affordable Care Act has been a cornerstone of the American healthcare system since it was signed into law in 2010. While the law itself is formally known as the Affordable Care Act, many people refer to it another name that has been possibly politically charged over the years, calling it Obamacare. For some, the term is simply shorthanded. For others, it has been used as a slur against the policy and the administration that created it. Regardless of the label, the law established a framework designed to expand healthcare insurance coverage, regulate the private insurance market, and provide financial assistance to Americans who could not otherwise afford coverage. One of the key tools within that framework has been the use of premium tax credits. These credits help lower the monthly cost of health insurance for millions of Americans who purchase plans through the Affordable Care Act marketplace. During the pandemic years, those tax credits were enhanced to provide even greater relief for households struggling with rising costs. However, those enhanced tax credits expired in the end of 2025. As a result, the year 2026 has begun with significant uncertainty for millions of Americans. Analysts estimate that as many as 4.8 million Americans could lose their health insurance during the 2026 period as the expanded assistance disappears. For families already navigating rising house costs, food prices, and inflation across essential goods, the loss of those credits has meant that health coverage has suddenly become far more expensive. In January of 2026, the United States House of Representatives passed a bill that would have restored those Affordable Care Act premium tax credits for an additional 3 years. The measure passed by a vote of 230 to 196, with some Republicans joining Democrats in support. The proposal aimed to stabilize insurance costs and prevent Americans from losing their coverage. Those credits would have helped millions of people continuing lowering their monthly insurance payments. But the effort stalled in the Senate. The bill failed to gain enough support to move forward, leaving the enhanced subsidies expired and millions of Americans facing higher costs. And those higher costs are already become visible in the data. For 2026 Affordable Care Act marketplace plans, premiums have increased roughly 21 to 26% nationwide. For many people who previously received subsidies, the amount they personally pay for their health insurance has increased by approximately 114%. In other words, some households are now paying more than double what they paid just 1 year ago for the same coverage. There are also early signs that people are beginning to lose their coverage altogether. Marketplace enrollment has dropped to about 15.6 million percent in 2026, down from roughly 16 million in 2025. Federal reporting so far indicates that about 1.2 million fewer people have enrolled in marketplace plans this year compared with the previous year. Looking ahead, projections suggest the impact could be much harder. Analysts estimate that about 4.8 million additional Americans could become uninsured during 2026 as the enhanced tax credits remain expired. In total, roughly 7.3 million people may lose subsidized marketplace coverage if no policy changes occur. So, while many Americans are facing rising premiums or loss of coverage entirely, another story emerged recently that has drawn national attention. Defense Secretary Pete Hegseth, a former television host, is now facing scrutiny after reports revealed a massive surge in Pentagon spending nearly the end of the fiscal year. A watchdog report found that the Pentagon spent $93.4 billion in September of 2025 alone. Even more striking, roughly $50 billion of that spending occurred in just the final 5 days of the fiscal year. Among the purchases listed in the report were $6.9 million spent on lobster tail, $15.1 million on ribeye steak, $2 million on Alaskan king crab, $139,000 on donuts, and $124,000 on ice cream machines. The list also included luxury furniture and musical instruments, including a piano costing $98,000. The Defense Department says the surge in spending is tied to what is known as a federal use-it-or-lose-it budgeting rule. Under the system, agencies are given a budget for the fiscal year. And if they fail to spend those funds, the next year's budget may be reduced. As a result, departments often rush to allocate or spend remaining funds in the final weeks of September before the fiscal year ends. Critics argue that this type of spending highlights deeper structural issues within a federal budgeting. If funds truly needed to remain within the defense system, there are many areas where they could have been redirected within the military itself. The same money could have supported equipment maintenance, housing improvements for service members, modernization programs, infrastructure repairs on military bases, or expanded support service for active duty personnel and veterans. Instead, the optics of luxury food purchase and high-end items arriving during the same period that millions of Americans face a loss of health care coverage has raised difficult questions. For a government that says it cannot afford to maintain expanded health care coverage for millions of its citizens, the contrast is for many Americans hard to ignore. When health care assistance disappears, while lobster tails and Alaskan king crab on federal purchase records, the divide between budget priorities and everyday realities becomes difficult to explain. Today's sources come from Commonwealth Fund, putting extraordinary increases in communities' 2026 perspective. KFF.org Affordable Care Act marketplace premiums would more than double on average next year if enhanced premium tax credits expire. Reuters Healthcare Pharmaceuticals Obama enrollments declines, U.S. subsidies expire. People Pete Hex's Pentagon spending spree. HA.org News 2026 House passes extended enhanced premium tax credits. Thank you for listening. Until next time, bye-bye for now.